right, welcome to News Talk. I'm Brandon Jones, Robert Harriman.
Hi.
We're going to jump right back into more COVID talk and New York City making more news.
Never enough.
It's kind of tragic. We're like spinning a wheel of things, and we end up on this one, and we'll get to some other stuff here soon. I want to encourage you to stick around and tell us some of the topics that you'd like to hear as well in case we don't cover something. But this is, it's really bad. It's
disturbing.
It is really disturbing. So, it really came to, at least it came to light. You see the little clip where Kayleigh McEnany, how you say McEnany? How you say his name?
I didn't see the clip, no. Yep.
Oh, so she's doing a press briefing, and Jim Acosta talks about, aren't you concerned with the Trump rallies that we're going to have all these people and not having masks and whatever? And she's like, well, yeah, I mean, blah, blah, blah. We're not going to mandate masks. Well, aren't you concerned? Blah, blah, blah. So she holds up the New York, make sure I got it right, New York Post. And there's a photo on the New York Post of all the protesters on one side of the page, Trump rally on the other side of the page. And then it was like, good, bad.
Different captions.
And it was like, wow. She held it up in the press briefing. Like, I sure hope that we see more headlines and coverage like this, too. Yes, the Trump administration is concerned. He's trying to advise people they should wear a mask, whatever. But we'd also love to see media coverage of events like this. Then we find out, again, New York City always has the best backstories of corruption and cover-up that should just shock us to our core. They're the worst COVID numbers and horrible death toll in our country, and we find out over and over again there's always more to the story. So here's another one. So they're trying to put together COVID data, and Bill de Blasio's office, this is Avery Cohen, and they are doing contact tracing for COVID positives. And this is put out on the Tampa Dispatch. You can also see information through New York Post, and we'll get to some of the others here as well, including, I believe, Deadline talks a little bit about it. Basically, no one will be asked proactively if they attended a protest, Cohen has said, the spokesman for de Blasio. This was an emailed response to the city website. They were the one that broke the story that test and trace workers ask COVID-positive individuals general questions that help them, quote, recall contacts and individuals that they may have exposed. Well, do you live with anyone in your home? Jonah Bruno, an agency spokesman, says, we're working with the New York City to balance the public health priority while also protecting personal privacy. We seek to ensure a thorough contact tracing program that helps us contain the COVID-19 virus and monitor any fluctuations in the infection rate as we continue reopening New York. Then they quote a doctor from Columbia, Dr. Patrick Couture, Kachur, from Columbia. This is public health official, says, I think the logic has to do with the fact that contact tracing requires a strong level of trust between the interviewer and the person they're talking to. It's really important to have a good rapport and treat people with ease. It's important not to ask questions that will impede on your ability to do the best job you can. Again, we don't ask them about going to a protest. Okay. Then he says this is the professor of public health advice discussing New York City. There's definitely a concern that state and city officials have that the protest could be a place where transmission occurs, but the risk is lower than the household and other community contacts. It would be really challenging to trace those contacts who you've been protesting with. Well, of course, but we're still not going to try to discuss that or at least have that in their factors.
But I don't think that's the reason. That's not what he just said is not the reason why they don't want to ask the question.
No, he's politically...
They want to manipulate public health data to keep the arrows pointed at the protest as a possible...
They don't want you to think the protest is where you can get this. They don't want you to think that that's remotely a stigma at all. They want to keep that in a positive light, just like the Kayleigh stunt where she holds up the paper.
I'm sorry. In by definition, by not asking those questions, that is not contact tracing.
No, you're omitting information.
Yeah. So, I mean, I think that's very dangerous. And I believe that if that was going on in the state of Florida...
Oh, Ron DeSantis is already under fire. And
he would be toast.
Yeah, it's crazy. Yeah.
So, again, everything is politicized. And it's harming public health, in my opinion.
It doesn't matter to me.
We need to know if some of these little sparks are starting at these protests.
It doesn't matter if it's a Trump rally or it's a Black Lives Matter protest or rally, it should be part of your questions. Have you been to any event, including rallies or protests? That's how I would word my question, right? Have you been to any event, including rallies or protests, in the last 14 days to 3 weeks, whatever the appropriate timeline would be for the way they work their questionnaires?
Yeah.
I mean, I don't understand why we have to make it. You don't have to mention names. Like, we don't need to call out Black Lives Matter. We don't have to call out any of these poor individuals that have lost their lives, that have sparked some of these rallies and protests. We don't have to call out the political candidates by name. Doesn't matter if they've been to a Biden rally. It doesn't matter if they've been to a local politician running for office and they had 70 people.
Just the fact that they were in a crowd.
Because then you had 70 people.
Yeah, because I guarantee they're going to contact Trace in Tulsa today if anything.
They will be there taking photos of every single person. We're recording this live on a Saturday. It will come out on Tuesday. So you're watching this, you will already have heard what will happen in Tulsa. Yeah. I'm going to predict people will be watching this and they can tell us how accurate we are. We will see tomorrow morning on Sunday papers. We will hear at Sunday talk shows. It will not be about Father's Day. It will, in fact, be about the people in Tulsa not wearing masks and not social distancing.
But, for all the people in the media and social media and elsewhere that are always science, 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 I'm sorry. This is not science. This is manipulating public health data, which is supposed to help us.
Well,
not science.
Man. You were exasperating my love of and frustration with New York in this situation of this horrible tragedy and pandemic, in that now Governor Andrew Cuomo is rebuking even in the slightest of questions in his handling of assisted living and nursing home patients that had gotten COVID anyway, that his possible mishandling of this, because he was sending positive patients back to their facility instead of keeping them isolated in a hospital. Right. Correct. So now what was his response? And
he's saying every time people bring that up, they are politicizing the matter. So and so far he's gotten away with it. That's a really sad thing, right? He's gotten away with it. Nobody's really calling him out on it. Now I get it that I am not in New York City, obviously, but I'm picturing it, right? And you're concerned that the hospitals there were probably crazy when this was.
I don't have any sympathy for this.
Right. No, I'm just saying. So they have limited rooms. So if you had people that were going there with few or no symptoms that were positive, you didn't want to take up hospital beds because there were so many serious people. So you have to put them somewhere. That was probably the place where you could put them on that boat.
Thank you. Yep, that's exactly where I was going to go.
Places instead of sending them back to a nursing home.
Yep.
I get it. Those ERs and those hospitals were probably off the charts. I can't even imagine the way it was at that time. But that decision, I'm sorry.
We found out
it's not being politicized. It's a fact.
We found out after the fact that we barely used the number of beds that were on the Comfort, the ship that we had sent there. We had barely used any of the resources at these sort of makeshift medical tent facilities that were there in the nearby areas. We found out that these are resources that were available. And even if you just use them for isolation of these are seniors who are high risk just because of their age. Maybe they're not. Who cares if they're high risk? They have it. We don't want to send them back to speed up the timeline.
A high risk place.
And then then it is incontrovertible. I'm sorry. It's evil to believe that a man has found out. In theory, my grandma could have gone to this hospital, found out she's positive. You would have sent her back. And then she would have infected the person in the same room or the nearby room or whatever, and then that person gets it and they die. Yeah. That is awful. And that there was basically a political decision and not in the best interest of the care. And we say that because not all the resources were being used.
Yeah. I just think it's a shame that somebody like Andrew Cuomo, who has got massive popularity up there because of this, he can't show any honor and be humble enough to admit I was wrong.
Well, the worst part is this isn't over. We were just discussing in another segment, COVID's not over. No. We're headed into the summer of COVID, the COVID summer. So sure, New York's seeing some numbers that have dipped down now, which are really more like in relative to where they were, not like it's gone away. Well, we'll head back into the fall. COVID's not going away, so it's not like you can continue to not have a policy on this or speak to this, because there will be positives in nursing homes and assisted livings. What are you going to do with those patients? Are you going to send them back? What about What do governors and leaders take away from all of this and what they could or should have done if you don't have a comfort and medical tents? And how do you isolate? And what are some of your thoughts on what have been the best practices or things that are what we should actually do?
Well, I mean, at the time, they also had the opportunity because all the hotels were empty. They could have
they could have designated a whole hotel.
Yeah, they could have done all kinds of stuff. I don't know if you're going to have that same availability in the future.
Yeah.
So, I mean, and I don't think we're going to be having the federal government spend millions of dollars to transform the Javits Center into a 1,000-bed hospital. So I'm not sure how that's going to be handled, But it's got to be handled better than the way Cuomo and Murphy and some of the others took care of it.
What is the latest on other places like that, like in New Jersey and some other hot spots and those kinds of things? So all the focus has shifted to the states that have reopened, Florida and Texas in particular, the two that are kind of on.
Yeah. I mean, their numbers have dipped, so they're getting kudos. And the 20-odd states that are cranking up, mostly southern and western states
that opened, that did not have cases, and now they do have cases, right. And it's spiraling exponentially.
And you could see, the media salivating over these numbers. And
how to politicize it.
Yeah. I mean, and each state is a little bit different too. I mean, I don't think, even though Florida's numbers are at a record high, we are nowhere like the situation that's going on in Arizona right now, where they are reaching very, very close to capacity in a lot of hospitals. Mm-hmm. So each place is different. You shouldn't.
Why is Arizona at capacity?
I don't know.
Oh, okay.
I don't know.
Do you know the geography of where they have cases and where they don't? Is that part of it?
If they're at capacity, I would assume it's in the major cities.
Okay.
Yeah, I mean,
because in Florida,
that's an assumption I don't have.
In Florida, if you look at the grids and the maps, you were still seeing massive numbers still growing in Miami and Palm Beach and these kind of areas. Now we're seeing some with around Orlando and Hillsborough County, but most of Florida still. Well, yeah. Very small numbers.
And I suspect that's the way it is in Arizona. It's probably the Phoenix area.
Phoenix and Tucson, Albuquerque.
Mesa, whatever, yeah.
In those cities out there.
That's a guess. I don't know that for a fact. But even here, Hillsborough County has 5,000 cases. You go up a couple counties to go down to Highlands County, it's like 200 cases.
Yeah, there's hardly anything like in Spring Hill. A friend lives in Spring Hill. He's saying something to me. I was like, dude, at the time, there were like 12. I'm like, there's 12 active cases. I think that those people are probably not going to be at the Walmart. I think your numbers are pretty good to live your life.
But I mean, Hillsborough and Orange County are cranking up, and
they're highly dense,
high population.
Yeah,
I mean, it doesn't take a rocket scientist to figure that out.
What is the lag time on data out of New York City or anything like that? Do we know these contact tracers and those kind of things? What is it on? Do you get data pretty regularly? We know?
No. Well, if you're concerned about, are they going to be able to figure out the numbers went up because of a potential protest, I would start looking at them pretty soon, because the protests were the end of May, beginning of June.
We had their first couple, but it really...
But they continue in some of these cities.
Sure.
They don't go away. 2 to 3 weeks, you should start seeing...
Yeah.
I mean, now granted, and the argument that MSNBC and all them are making for the protesters is, yes, it's outside. Most are wearing masks. A lot of them are wearing masks because they don't want to be seen.
Sure.
I mean, but that's
yeah, I know.
That's a motivation. But yeah. So I would expect it might not be as bad as people say, but who knows?
All right.
Who knows?
Tell us what you guys think. Tell us what the media said about Tulsa. Were we right? I think we're going to be right.
Tulsa,
New York City, and Cuomo. Good hats and bad hats. We're talking about black and white hats, and it's just the media. It's such a fallacy. It's really frustrating. So frustrating. And sad part is that this is so serious that people's lives are at stake. So, all right. Well, that's another topic there on New York City. Tell us your thoughts and share, like, and subscribe, and join our audience there.